This is Randy. He is a 45-year-old man with hypertension and uncontrolled type 2 diabetes. He is also a smoker and drinks 2 beers a day.
One day, as Randy and his dog Turbo were strolling through Central Park, Randy suddenly started to feel funny.
Randy had a sharp headache, confusion, numbness on the right side of his face, arm, and leg, and experienced a sudden difficulty in speaking. Turbo knew something bad was happening and barked for a passerby to come help.
Randy was taken to the hospital by ambulance. Upon arrival to the hospital, the nurses noticed his symptoms might indicate a stroke and conducted the National Institute of Health stroke scale while taking Randy to get a CT scan. The results of the scan showed that he had an embolic stroke.
Embolic stroke is caused by a blood clot that originates from anywhere in the body. The clot breaks off and travels to the brain. It can block blood flow and lead to tissue necrosis, which causes stroke symptoms and deficits. The clot is most commonly plaque that breaks off the endocardium.
Randy received TPA, or tissue plasminogen activator, in hopes of breaking down the blood clot. He was monitored for 24 hours before receiving another CT scan that showed no more clot.
His nurse conducted an assessment of all his systems and noticed that he still had right-sided weakness and had some trouble swallowing. In addition, Randy seemed very anxious, repeatedly saying, "What if I have another stroke?"
Now that Randy is stable, let's take a look at the goals that need to be addressed on his way to recovery.
The 5 goals for Randy are to regain the highest level of physical functioning, re-establish self-care abilities and skills, improve his swallowing function, address his anxiety for another stroke, and to make sure he understands the modifiable risk factors for stroke.
For the goal of regaining his highest level of physical functioning, Randy would go to physical therapy. There, they would focus on mobility, progressive ambulation, transfer techniques, and equipment needed for mobility.
To re-establish Randy's self-care abilities and skills, he would attend occupational therapy, where they would focus on self-directed activities such as eating, dressing, hygiene, cooking, driving, and more. They would also provide equipment to help with daily activities.
To improve his swallowing function, Randy would see a speech therapist. The speech therapist would help Randy with his speech, communication, cognition, and eating abilities. Some activities that they would do include repeating word exercises, reading and writing exercises, and practice following directions.
To address Randy's anxiety, the nurse would validate his concerns, be an active listener, suggest techniques to ease his anxiety, such as deep breathing, listening to music, and encourage family support.
To help Randy modify his risk factors, the nurse would educate him about the common risk factors for stroke, such as hypertension, diabetes, high cholesterol, obesity, smoking, and alcohol and drug abuse. The nurse would also suggest ways to modify his lifestyle.
In Randy's recovery, physical therapy helped improve his right arm strength and to walk on his own. Also, Randy is able to perform self-cares independently. However, he still has trouble with eating. To address this, occupational therapy taught him to use a universal cup to aid in using utensils. Randy had a little difficulty with swallowing after his stroke, so speech therapy worked with him to improve his posture and body positions to promote safe swallowing. The speech therapist taught him to sit upright, tuck his chin down, and to continue sitting for 30 minutes after his meals.
The nurse calmed Randy down with deep breathing. Based on his history, she emphasized that high blood pressure weakens the vessels and can cause them to burst or clog. She suggested following up with a physician to see if medication is an option and to increase physical activity.
Physical activity will also improve his uncontrolled diabetes because it will help increase insulin sensitivity and lower blood glucose. High blood glucose increases fatty material deposits in the vessels that could lead to stroke.
The nurse stressed smoking cessation because smoking is a risk factor for stroke as well as other conditions such as cancer. Finally, the nurse recommended that Randy limit his alcohol intake because alcohol increases the risk for hypertension, which increases the risk for stroke.
Randy continues physical and occupational therapy in an outpatient basis. He has really taken to heart the education he received and is controlling his blood pressure, blood sugar, and even quit smoking and drinking. He is feeling better than ever and hopes this effort will keep him from experiencing another stroke.
created using Powtoon.